Very much, Mr. Meadows. Mr. Bera.
Thank you, Mr. Chairman, and thank you for calling this hearing. I share your concern over human rights abuses as well as your commitment to fight these abuses worldwide. One fundamental right is freedom over one's own body and the right of women to control their own reproductive decisions. That is an issue of individual liberty. As a doctor, this issue is particularly important to me. I took an oath to answer my patients' questions, to provide them with various options, to explain the risks and benefits of these choices, and then empower them to make the best decision that fits with their own faith, family, and personal circumstances. This is a fundamental to the doctor-patient relationship. That's why I have concerns about China's one-child policy. It goes against the fundamental value of individual liberty and freedom. While forced abortions and sterilization are illegal in China, they still happen with frequency, and the one-child policy perpetuates these practices. All champions of human rights should openly condemn China's one-child policy and the illegal practices of forced abortion and coerced birth control reported in some localities. The continued oppression of Chinese families through coercive reproductive policies must end. But claiming that the UN Population Fund supports these coercive practices and using the claim to oppose U.S. support of international family planning programs is disingenuous, unmerited, and bad global health policy. In fact, the best way to promote the basic human right of individual choice is to invest in programs like the United Nations Population Fund. UNFPA's programs save and improve the lives of millions of women and men worldwide. They enable couples to voluntarily determine the timing, number, and spacing of their children and voluntary birth control. Independent experts have confirmed that UNFPA does not support the one-child policy in China, nor does it support forced sterilization. UNFPA supports increased access to reproductive health services, improved approaches to adolescent reproductive health, and safe pregnancy and delivery. Its programs have reduced maternal mortality, provided emergency assistance in refugee situations, and prevented and treated HIV and AIDS. As a doctor and public health expert, this is good public health policy. The U.S. should remain a strong supporter and leader within the global community in order to best promote women's rights and the freedom of every woman to make personal decisions about her health and her future. Individual liberty and freedom are American values that are worth fighting for, both here domestically and throughout the world. Thank you, Mr. Chairman. I yield back.
Thank you.